Has been associated with an increased risk of end-stage renal failure and has many other complications. So in this week, let's unite to raise awareness about the issues related to kidney stones and its impact in the life of people living with it. To throw more light on the subject and guide us on what's right for diagnosis and treatment of kidney stone, today we have with us Dr. Naresh Kumar sir. It gives me an immense pleasure to introduce Dr. Naresh Kumar sir to you all. Dr. Naresh Kumar is a senior consultant urologist at Indrani Hospital, Bhatinda. Sir has a rich experience in the field of urology and carries out the treatment with utmost precision and efficiency, ensuring that the patient's health is in safe hands. Sir, it is a pleasure to have you in our show. We welcome you.
Thank you. Thank you very much.
So, sir, there are many things that we would like to know about the kidney stone. So, first, we will start with its meaning. What is kidney stone or renal failure? Renal
kidney stones, these are the stones which are formed in the kidneys because we have two kidneys in our body. So, these stones can form in either of the kidney. Most of these stones, they are calcium containing stones because calcium is the mineral which is secreted in the urine. So majority of the stones, they contain calcium, so they can be seen on X-rays very well.
Okay. So, sir, how do these stones form? What can be the causes behind it?
Actually, the function of kidney is to filter the urine. So they as a filter in the body. So in the blood, there are waste products which are formed by the cellular activities, and these waste products they are like uric acid, urea, calcium, magnesium, and other products which are released in the blood. So this blood need to be cleared or filtered by the kidneys. So these waste products they come into the urine, and when there is a increase of these minerals in the urine, or there is a decrease in the water quantity in the urine. So these minerals they form the crystals, and these crystals they combine and they form the stone.
And sir, who are more prone to this kidney stone? Who can have this in their life?
Actually, kidney stone can occur at any age. Even in children, kidney stones are seen. But majority of the cases they are seen in the age group of 20 to about 50 years of age. And there is a difference in composition in children and in the adults. In children, majority of these are due to mineral metabolism defect. So these children, so they can get the stones. Although in children, it is very less in quantity, but they can happen in the children. In adults, majority these are due to decreased water intake or increase in some food containing a high quantity of oxalates, uric acid. So these are the cause of stone formation in adult age.
So not only adults, even the children can have it. So it is quite scary, and everyone who are listening to this live session, please be really, really careful that anyone can have kidney stone. So you'll have to be really careful about that. So, sir, what are the early signs or symptoms through which one can get get to know that there's something wrong with his kidney?
The most common symptom of kidney stone is pain. Patient will get a person will get a flank pain. That pain is a typical which starts from the back and radiate to the front. So that is the first symptom which makes it clear that it may be a kidney or a ureteric stone. And it is the symptom for which patient seeks attention, goes to the doctor. Another is patient may some large stones like staghorn calculus. Patient doesn't feel any pain, and they come with a urinary tract infection. So on evaluation of urinary tract infection, we find that the patient is having stone. That's why he is developing recurrent infection. And in some cases, if even patient they doesn't know that they are having stone, but this end up in renal failure. And on evaluation, we find that this renal failure is due to the stone. So main symptom is flank pain.
So there are many symptoms through which we can get an idea that yes, we might be suffering from the kidney stone. So, sir, once we get the symptoms and we have gone to the doctor, how can we get the surety? What are the tests which have been conducted so that the patient will get the surety that he is suffering from kidney stone?
First, when the patient reaches the consultant, then first is the history, a typical pain, and any fever. Then urinary symptoms, patient may develop irritation or dysuria or increased frequency of micturition. And then the examination. Examination of the patient can tell that whether the pain or the symptom they are due to the stones or urinary tract problem. And then after that, we advise ultrasound. Ultrasound, because these are the calcium containing stones. So ultrasound can pick up to 99% of the stones in the kidney. So that is a very good and cheap and easily available investigation to find out the stone in the kidney. And another investigation is X-ray, X-ray of the kidney, ureter, and bladder, which we prescribe. On the X-ray, 90% of the stones are calcium stones. So these can be well seen on the X-ray. Only 7 to 10% stones, they are radiolucent, which cannot be seen on the X-ray. But even these radiolucent stones can be seen on the ultrasound. So ultrasound and X-ray KUV, these are the preliminary investigations to find out that the patient is having a stone disease.
Okay. And sir, after how many days the patient will get these reports?
Patient will get these reports immediately, because ultrasound is operator dependent. Sonologist or the radiologist will perform the ultrasound and immediately prepare the report. And even X-ray, we will get a film of the X-ray within 5 to 10 minutes.
Okay, so this is a good thing actually, that the patient won't have to wait for long. Immediately he'll get the report and immediately he'll get to know that whether he is suffering from kidney stone or not. Yeah. So this is a good thing actually. Yeah. And sir, how many types of kidney stones are there, and which size is considered as dangerous, which cannot be diluted on its own?
There are many types of kidney stones. Most common stones which we encounter are calcium oxalate stones. They can contain calcium and oxalic acid, calcium oxalate stone. Another are calcium phosphate stone. Then patient may develop uric acid stone. Another is in patient with diabetic with proteinuria. They have matrix stone. These stones are radiolucent. We cannot see on the X-ray. And another patient who are HIV positive, they are on ART, antiretroviral therapy. They can develop indinavir stones. In children, there are magnesium ammonium stones, cystine stones. So there are various types of stones. The most common we encounter are the calcium oxalate and calcium phosphate stones. Another thing is, what was the next? Another question, please.
Yes, sir. So, sir, once we have got the report and we got to know that we have got kidney stone, so what are the possible treatment options?
Treatment depends on the stone size and whether it is causing symptom or not. Sometimes patient comes with ultrasound report, which is done either as a routine health checkup or for any other problem. So they may have small stones, 2 mm, 3 mm, or up to 5 mm in the kidney, but they are asymptomatic. They are not having any kind of trouble with the stone. So these stones, they can be left as such, and patient is advised to change the lifestyle, take lot of liquids. Take a lot of liquids. Liquid intake should be around 3 liters per day, and exercise and weight maintenance and treatment of the other any comorbidities if he is having. But if it is causing symptom, even a 3 to 4 mm stone, it can lead to a severe pain, and it will need a treatment. So up to 5 to 6 mm, we prescribe the medical treatment, because these are the most likely stones which can pass by itself. only with the medication, not requiring any kind of intervention. But from 7 mm to 10 mm, there is a gray zone. These stones can pass or cannot pass. There is a 50% chances. So in these cases, we advise the patient if with medication his pain is settled, his symptoms are relieved, and then he can undergo repeated ultrasonography every 15 days to see the movement of the stone, whether the stone is moving from previous place or not. If it is moving, we can keep him on the medical treatment. Otherwise, he will need some kind of intervention to remove the stone. In intervention, we have now we are doing it by endoscopy. So open surgery is very rarely done nowadays. So it is endoscopic procedures. For kidney stone, we do percutaneous lithotripsy, that is called PCNL, in which we make a small hole about less than 1 centimeter into the kidney and remove the stone by either by breaking it with a laser or pneumatic lithotripsy. If the stone is in the ureter, we can remove it through the urethra. That is called ureteroscopy. So patient doesn't need any kind of stitch, any kind of incision. So we can break the stone within the ureter and remove it through the urethra, urinary tract. And similarly, in the bladder stone, we can remove the bladder stone by the urethra. Now there is a newer technique that is called RIRS, retrograde intrarenal surgery. So in that case, we can go up to the kidney from the urethra through the bladder, through the ureter into the kidney by a flexible ureteroscope, and we can see the stone and we can dust the stone with the laser, and that dust is passed into the urine. So patient doesn't need PCNL even. In small stones up to 15 mm stone can be cleared by the RIRS. That is the latest technique in stone management in the kidneys.
Okay. So, sir, whenever patient they hear about surgery or the operation, they get usually very scared and they try to avoid going for the surgery. So, apart from the surgery, can the patient get rid of this problem by just taking medicine?
As I told earlier, up to 6 mm stone, they can be getted by the medication only. Between 7 to 10 mm stone, some patient they pass it spontaneously only with the medication. But in some patients, the stone gets stuck and at 2 or 3 places in the ureter, so they need removal of the stone. And nowadays, there are endoscopes are so fine that patient doesn't need any kind of open surgery, any kind of incision. It is almost a painless procedure, daycare procedure. Patient can be admitted in the morning and can be discharged in the evening if he is comfortable. So nowadays the surgery is not that much scary. So patient can be counseled and he can undergo and remove the stone in a single sitting.
Okay. So there is nothing to worry about it. All the viewers who are listening to us, if you're going for the surgery, if the doctor has advised that you will have to go for the surgery, you don't have to worry about it because the science has really advanced and everything will be done under expert supervision. So there's nothing to worry about it. So, sir, after the surgery, how many days will it take for the patient to get back to his normal life and start doing the physical activity?
After surgery, if we are doing a PCNL, in PCNL we are making a hole in the kidney. So there is some bleeding is there, and the kidney that hole needs some healing. So patient can do a routine activity on the very second day, but we advise to take a rest for at least 7 days. Rest means patient cannot go for morning walk or long walk, cannot do a heavy work, but he can do routine work. He can sit at home and do a work at home on laptop, or he can go to the office. After 3 4 days, he can go to the office and do a sitting work. But in case of RIRS, ureteroscopy or ESWL, patient can go and do the work on after 1 or 2 days. So there is a no worry about that their work will be suffered with the surgery.
A very important information we got over here, that after surgery you don't have to think that now you're perfectly fit and fine and you can go and do the physical activity. Please listen to the urologist, and whatever suggestion has been provided, please follow that. Post surgery, the body is really sensitive and you will have to be really, really careful. This is for all the viewers who are listening to us. And sir, when the patient is taking the medication, so there are some of the other side effects related with the medication that we take. So what are the side effects for the medicine that we take for kidney stone?
Actually, the side effects are mainly of the medication which are given to relieve the pain. So pain medication which we use, they can cause acidity problem. They can cause ulcers in the stomach if they are taken for a long time. And another thing which we prescribe is the alkalizers to decrease the urinary problem. These alkalizers, they contain potassium. So if in patients who are having chronic kidney disease or having hyperkalemia in their body, potassium is already high. So it can affect the heart. And another thing, if stone is in the lower ureter, we prescribe alpha blocker. Alpha blocker that relaxes the ureter and help to pass the urine, also decreases the pain episodes. So these alpha blockers, they can cause postural hypotension. Patient may feel dizziness while getting up from the bed. That happens for 1 or 2 days, and then it becomes useful to it. And another side effects is retrograde or anejaculation with this alpha blocker. But because these alpha blocker, they are given for a short period of time in stone patients. So these problems, they can subside when the treatment is over. So nothing to worry about these symptoms.
Okay. So yes, the side effects are there, but there is nothing to worry about it because the solution is also there for these side effects. Okay. So sir, we are taking a few questions that we have got from our viewers. And the first one is from Ajit, and he is asking, what are the food items that one should avoid if he is having oxalate stones?
Yeah, mainly the first recommendation is to drink a lot of liquids. In liquids, we can take water, then juices, mainly the orange juice, mosambi juice, or pineapple juice. These contain citric acid. This citric acid is normally present in the urine, which prevent the stone formation. So if we can take it from outside and increase the citric acid in the urine, we can prevent this stone formation. Apart from this liquid intake, the recommendation for liquid intake is around 3 liters per day. That will be approximately 12 to 15 glass of liquid per day. In oxalate containing stones, especially, we have to avoid high oxalate foods which are having rich in oxalate, especially the spinach, then chocolate, brinjal, tomato, and other products like black tea and nuts. These contain high oxalate content. So these should be taken in very small quantity, or they should be avoided if possible.
Okay. And sir, next question is from Namisha, and she's asking, sir, are there any long-term consequences of having a kidney stone?
Yeah, definitely. The kidney stones, if they are left as such, they can cause you symptoms like pain, and then they can cause you infection in the urine or infection in the kidney. They can cause hydronephrosis in the kidney. They can block the kidney. And if they are kept for a prolonged time, they can cause damage to the kidney, and the kidney may become non-functional, and then it will need a removal of the kidney. If both kidneys are damaged, the patient is then without any filter in the body, so the blood has to be filtered by the dialysis machine. So he has to undergo dialysis, which may be temporary or permanent, and ultimately, if a young patient, they may need a renal transplant.
Okay. So we cannot take the chance of ignoring any symptoms, as we'll have to be really, really careful, and we have to really have a healthy kidney which can function properly. So
Yeah.
be really careful in the beginning itself. As soon as you are finding any symptoms, please consult the urologist so you can get the treatment right at the correct time. So, sir, there are many patients or people who are naturally born with just one kidney, or in their lifetime, there are chances where the person needs to remove one kidney. So, what are the things that he or she needs to keep in mind? How can they have a healthy lifestyle?
Yeah, some children they are born with a single kidney, or some patient they donate the kidney for their relatives for renal transplant.
Yeah.
So then they have to keep a care of the single kidney, because single kidney, if it is damaged, they will need a lifelong dialysis. So they have to drink a lot of liquids. They have to take a balanced diet, regular exercise, and they have to maintain their weight properly, because obesity is also a risk factor for stone formation. Obesity also lead to a metabolic syndrome, which cause diabetes, hypertension, and
Mhm.
hyperlipidemia. Diabetes and hypertension, they are itself a risk factor for renal damage. So it can cause diabetic nephropathy, and hypertension can lead to even nephropathy. So the weight reduction, lifestyle modification, exercise, a lot of fluid intake, so these are must for these persons.
So all these points which sir has just now mentioned need to be followed rigorously, as it will really help you all to have a healthy lifestyle. So we can also do our bit so that we cannot have this particular problem. So a very, very important points we got to know over here. And sir, if the patient is feeling, as you have mentioned, that the in the symptoms itself, that the pain will be very severe. So when the patient is experiencing a very severe pain and he or she is in his home, so in that duration, when the patient is been taken to the hospital, what can be done so that the pain is can be, like we can say that the pain can be reduced?
If there is a severe pain, because every household nowadays they are having some medical kit, they will be having pain medication. So it is a simple diclofenac tablet or combiplam tablet they can take for the timing till they reaches the hospital. That can relieve the pain, because diclofenac is a very good analgesic to relieve the renal pain.
Okay. So we can take help of the painkiller for a time being, but the best thing is just to consult the urologist so that the proper treatment can be provided. Very well, sir. And how many days will it take for the patient to get completely rid from this problem if he or she is going for either medication or the surgery?
Actually, if the patient is going for medical treatment, it is very difficult to predict in how many days the stone will pass. But if the stone has reached into the ureter, then it is said that in a study that it will take around 45 to 50 days. This stone should come down, and it should come out of the body. So, but still, it varies from person to person. The main thing is it should move from its previous place to the another place within 15 to 20 days. So we advise ultrasound in such patients within 15 to 20 days to see whether the stone is progressing down or not. If the person is undergoing some kind of intervention, uh, in case of PCNL or uteroscopy, we remove the stone itself intraoperatively in the operation table, and we make sure that there is a no leftover stone before the patient goes out of the operation table. So the patient is free of stone once he undergoes surgery, and he is free of stone once he leaves the operation table.
And so once the treatment is provided, are the chances there for the kidney stone to reoccur?
Yeah, there are chances. So chances are very high if the stones patient is a recurrent stone former. If he is passing stone regularly, there are high chances that he will be having stones further. There is a high likely of chances within 1 year patient may have second episode of stone recurrence. Uh, Especially these patients, they need to take care of their diet and liquid intake because the risk of renal damage with the recurrent stone formation is very high.
So need to be really careful throughout. Even after surgery, we cannot take the risk, we cannot ignore, or we cannot be just going around and then giving the chance for this particular problem to reoccur. So it's our duty as well. Another very important point, sir. And sir, is this particular problem, kidney stone, is it genetic?
Genetically, actually, it occurs in families also, but genetically, if this is the problem, then it occurs in the children. So mainly in children, if they are having inborn metabolic defects or hyperparathyroidism, they can develop a stone very early in the age. So otherwise, it is mainly not related to the genetics. It is related to the environment, related to the lifestyle that patient develops the stone.
So yes, sir, there are many lifestyle changes that has come nowadays, especially due to lockdown, that everyone is in their home, so they do not keep in mind what they are doing. They don't have that much of physical activity. So yes, the chances can be there. And so from this, a very important question has come from our viewer, and this is from Rekha Shukla. She's asking, sir, are children also prone for kidney stone due to high intake of junk foods?
Yeah, definitely. Junk foods, they are very detrimental to the health. They increase the risk of overweight. Then these overweight or obese people, they are having multiple chronic problems, which increases the risk of stone formation. So mainly the metabolic syndrome that itself is a risk factor. So they are having a high risk of stone formation.
So yes, we should not take junk food as advised by our parents. We should eat only healthy foods that will really help us. And so there are few myths associated with the kidney stone that I would really like to ask in this live session. And the first thing is that people think if they will drink beer, so the kidney stone will dilute on its own. So is it true?
It is false. Beer or any kind of liquid, it cannot dissolve the stone. The only thing is if the person is having a stone in the lower ureter, he drinks beer or any kind of alcoholic beverage, he develops diuresis. So immediately there is a diuresis, lot of urine production. So that stone can pass. But actually, in actual, the alcohol intake that causes dehydration. So once we are taking the alcohol, at that time there is an increased production of the urine because of increased intake of the liquid. But after some hours, there is a dehydration in the body. So that dehydration decreases the urine output. So that and urine become concentrated. So chances of stone formation is high in the person who are chronic alcoholic. So alcohol or beer is not answer to treat the stone.
Mm. So it can be just an excuse of having alcohol, but the reality is that it will not help in diluting the kidney stone. So this is truly a myth. Okay,
Yeah,
and so
beer or alcoholic content it only act as a liquid. So if we take other kind of liquid, they will be much better and they will be doing the same effect as the alcoholic.
okay, and so how many liters of water should we take in our day? How much is advisable actually?
It is recommended to take 2.5 to 3 liter of liquid intake. It contains water, milk, juice, tea, any kind of liquid. So if roughly we count, it will be 12 to 15 glass of liquid per day that should be consumed, and it should be consumed regularly throughout the day. It should not be like that. We take 5 to 6 glass in the morning. We have a dry period of afternoon, and then we take 6 to 7 glass in the evening. So it should be a balanced liquid intake throughout the day.
Definitely. So, because the patient who are suffering from urinary incontinence or BPH, sir, automatically they just try to reduce the consumption of water as a thing that they will have a frequent or sudden urge to pass urine. So indirectly, it does affect the kidney, and so the patient cannot take the chance of ignoring it, or they'll have to have sufficient amount of water, and that is 2.5 liters to 3 liters as suggested by sir, as it will really help you all. So,
Yes.
sir, next myth is that people think that if they will eat kidney beans or rajma, then they will really keep their kidneys healthy and they will never have kidney stones. So, is it true?
Oh, no, it is not like that. Kidney beans does look like kidney, but they are not that boon for the kidney. So it is not that they are seeds. So seeds, any kind of seeds like that rajma or peas or any kind, they contain more of the uric acid. So if we are taking more seeds, these seeds will increase the uric acid in the body, and that uric acid will be filtered into the urine. So patient will be having more of uric acid. Even the persons who are taking more of a non-vegetarian diet, like chicken, mutton, etc., because these contains amino acids which are converted into urea and uric acid. So these persons, they are more prone to have uric acid.
Okay. So it may have an indirect impact actually. It can give rise to kidney stone. So be really, really careful with what we eat or what we follow. So this is again a myth that kidney beans won't keep your kidneys healthy, but yes, it can indirectly impact the kidney. So we'll have to be really, really careful with that.
So in diet, we should take these substances to the minimum. We should not remove from the diet because there are these are very good source of protein also.
Yes.
So protein is needed for the body, but we should not consume them in excess.
Yes, definitely. So need to be really careful with the diet that you follow or the suggestion or the guidance that you take, because there are many things that can form a kidney stone and there are many things that can be really helpful for you. So the best thing for all our viewers is please consult the urologist. They will suggest you what is actually needed, so you will get the proper guidance. And so from this point, another important question comes, and it is a very important for all the viewers as well, because many people or the patient, what they do when they find any symptoms, they just try to google the symptoms or try to ask their friends or relatives, and then they try to follow their own remedy. So how dangerous is this for the patient?
There is a term coined for this syndrome that is called idiot syndrome. The person who treat themselves by googling, that is not a very good idea, because if we see on Google for a one symptom, there are a lot of information, so we can misinterpret as a disease of some other organ or other problem and take a wrong medication that can have a detrimental effect on the health and that organ. So we should not take medication by ourselves. There are some medications which we know that, because there is a pain, we can take some pill for the timing till we consult the consultant. That's okay, but taking medication by ourselves for whole of the problem is not good.
Certainly. So cannot take the chance of ignoring it. So we'll have to be really careful with that. Consult the urologist. There only you will get the proper guidance and treatment. And sir, is the question for the old age patient, because the old age patient generally it happens that many a times we cannot perform the surgery on them as their body itself is very weak. And if they have kidney stone and they are not responding to the medicine, so in that case, what can be done?
In old age, even now, because of the refined kind equipment, we can do surgery even up to 90 years of age if the patient is fit. So we have to check the fitness, is cardiac status and respiratory status. If a patient can tolerate the surgery, that is the best for him. Otherwise, if the patient is not fit for any kind of major surgery and he is having a stone which is stuck in the ureter or it is causing pain, we can just place a DJ stent. So DJ stent is a stent which is placed from the bladder, urinary bladder up to the kidney. That can be placed under even under local anesthesia without any kind of anesthetic risk, especially in case of females. In males, it may require some kind of anesthesia for 15 to 20 minutes. So the risk is very less. That stunt can relieve the symptoms and it can save the kidney.
Okay. So there also the utmost care will be done. So then also there's nothing to worry. The treatment is possible. And so in the end, what is the suggestion for all our viewers who are listening to you so carefully and trying to understand what is kidney stone and what can we do for getting rid of this kidney stone? So what are the suggestions, sir?
Suggestion is first I will give that you should change your lifestyle. So first is the liquid intake, balanced diet, regular exercise, maintenance of a proper weight, and if another thing is a regular yearly health checkup. So that regularly year health checkup can pick up a lot of problems which does not cause any symptom, but which can cause damage to the kidneys or any other organ of the body. Especially ultrasound, which is very cheap, easily available without any radiation effect, that can be done, and it can pick up the stone disease. And if the stones are significant, that can be get rid of as early as and the kidney.
Definitely. So, sir, we got to know many things about the kidney stone, and it was indeed a very informative and valuable session for all our viewers. So, thank you so much, sir, for such a valuable session and for your time, sir.
Thank you, ma'am, for giving me this opportunity. Thank you very much.
And thank you to all our viewers for being so patient and asking all the questions related to kidney stone. I hope you have taken all the due note of all the important points that we have discussed over here. You can follow us on our FB page. You'll find us by the name of Bladder Wellness. You can also follow us on YouTube, Twitter, and Instagram by the same name, that is Bladder Wellness. So we will see you all soon. This is your host,